Good day, class. This is week 4 of our virtual class. I am Sir MJ and welcome to our class. Today we're going to discuss about consumer health. But before that, class, let me ask you the following question. First, where did you last spend your money? What item did you buy? What kind of service did you last avail? Who recently shared with you a new health information? Do you consider yourself as a consumer? Let's discuss consumer health. What is consumer health? So consumer health class aims to develop a person's ability to evaluate and utilize health information, products, services wisely and effectively. We are all consumers class. We acquire health information, purchase health products, and develop health services to appraise, improve, and maintain our health. These are only a few of the things that concern you as adolescents. The first one is decision making. So decision making must learn in order to live a healthy and normal life. In this slide, we must all be educated consumers who make selection of information, products, and services that's scientifically proven and legally approved. Now class, there are 3 components to remember when we talk about consumer health. Number 1, we have health information. Health information is any idea that we hear from people around us, read framed books, and other printed materials, or from media that influence our health. This may also involve ingredients, or raw materials used, nutrition facts, direction of consumption, expiration date, and even serving amount. Manufacturing company, prescribed consumer, and cautions. Number 2, we have health products. Health products class are items that we consume to improve our well-being like medicine, food, clothes, furniture, and electronics, and many others. These products may be purchased from various places like supermarkets, pharmacies, and hospitals. We must be very careful in the products that we use. Some products can bring bad effects to our health, so make sure that these products are approved by the Food and Drug Administration in the Department of Trade and Industry. So choose products wisely. Number 3, we have health services. Health services class are programs we avail from various providers such as physicians, nurses, therapies, health workers, hospital clinics, and other health facilities or institutions. Choose health services that is run by health professionals class. We can just trust anyone to help us in our health problems. Some examples of these health services: insurance, treatment, and cure, complementary and alternative medicine. So do not submit yourself to person who are not authorized class or licensed to provide health services. We have to deal with health professionals who are capable in helping us when it comes to our health concerns. People acquire health informations and products from various sources like people, media, and technology. Reliable sources class of health information and products are licensed professionals who took up specialized and intensive studies in the field. These are the ones who have the qualified educational background and can give scientific explanation to validate information. We can also find reliable information from health books and online resources. Unreliable information are sources of information and products from people who are not experts in the field. Here's some unreliable sources of health information. Number 1, customs and superstitions. Number 2, information based on ignorance and prejudice. Number 3, commercialized health information. Here's some objectives class of consumer health. Number 1, Assist consumers in choosing better health products and services. Number 2, provide information regarding health products and consumers, which to buy and health services they wish to avail of. Number 3, help consumers recognize reliable sources of health information. And number 4, guide consumers in buying health products and services. Now, let us find out what are the different kinds of consumer. First, are you an intelligent consumer? You prioritize your needs and limit your purchase on your ability to pay. Or are you a spendthrift consumer? You lavish spending of luxury and lost the vocabulary of the word economy. Are you a bargain addict? Who is obsessed to all types of sale? Or are you a close-fisted consumer? You hoard a lot of money but deprive yourself in needs. Or do you panic to hoard unreasonable stocks of supplies? Then you are considered as a panic buyer. Are you an impulsive buyer? Who shops on a whim? Then, regret creeps in when the time comes to pay your bills. How about consumer health education? It is the process class of assisting you to acquire the correct information and understanding so that you will be able to make a wise decision about a certain health item. Here are some guidelines on the purchase of goods and services. Number 1, judge which products or services will be beneficial, harmful, and useless. Number 2, know the local laws and regulations that protect consumers. Number 3, locate dependable medical, dental, and nursing services. Number 4, apply knowledge acquired with respect to personal and environmental health in the purchase of a personal goods and services. Here are some reliable sources of health information. First, friends, neighbors, relatives. They are reliable sources because of the information they will give you is true and who will not let us buy products that may harm us. Number 2, professionals such as physicians, scientists, teachers. They are reliable because their information will be based on research and studies. Number 3, educational institutions. They are schools, colleges, or universities which will give us the right information. Number 4, media such as radio and television. Their information is screened first before they are aired, so they cannot give wrong information. Number 5, print materials such as magazines, journals, newspapers, books, pamphlets, posters. Their information is screened and edited before they are published. Now let us find out what are the 15 types of doctors. The first one is a dermatologist, who is a skin specialist. He or she is a specialist in dermatology, especially a doctor who specializes in the treatment of diseases of the skin. The second one is a cardiologist, who is a heart specialist. A cardiologist is a heart doctor. He or she is the one to visit if you feel a tightness in your chest and shortness of your breath. Third one is a gynecologist. She is a female disease specialist. Gynecology is the branch of medicine dealing with the health care for women, especially the diagnosis and treatment of disorders affecting the female reproductive system. Number 4 is a dentist. He or she is a doctor of teeth and jaw bones. A dentist, also known as a dental surgeon, is who specializes in dentistry, the diagnosis, prevention, and treatment of diseases and conditions of the oral cavity. Number 5 is an ophthalmologist, who is an eye specialist. A specialist concerned with the study and treatment of disorders and diseases of the eye. Next, we have orthopedist, a muscle and bones expert. Orthopedist is an orthopedic surgeon, a physician who corrects congestial and functional abnormalities of the bones with surgery, casting, and bracing. Orthopedists also treat injuries to the bones. Next, we have anesthesiologist. He is a specialist who administers an anesthetic to a patient before he is treated. During the surgery, the anesthesiologist will monitor the patient's blood pressure, heart rhythm, temperature, level of consciousness, and the amount of oxygen in the blood. Number 8 is an endocrinologist. Diagnoses and treats diabetes, hormone imbalances, thyroid disease, and other disorders of the endocrine system. Next is gastroenterologist. Specializes in diseases of the digestive system. Number 10 is hematologist. A hematologist specializes in diseases of the blood and bone marrow. Hematology is the diagnosis, treatment, and prevention of diseases of the blood and bone marrow, as well as of the immunologic, hemostatic, and vascular system. 11 is a hepatologist, who specializes in diseases of the liver. 12 is a neonatologist. He or she cares for premature and critically ill newborns. 13 is a neurologist. A neurologist specializes in the diagnosis and treatment of all types of disease and functions of the brain, spine, peripheral nerves, muscles, and nervous systems. Number 14 is a pediatrician. He or she is a child's physician. Lastly is an oncologist. He or she is a doctor who treats cancer. Okay, so that's it for today. I hope you were able to understand our lesson. On our next virtual class, we're going to accomplish our learning tasks 1, 2, 3, and 4. Good day, and I'll see you again.